Hello, my name is Hazwani Damanhuri and I am a PhD student in communication. This paper is part of LRGS project led by Associate Professor Dr. Mirza Wati Mohamad and together with Dr. Arina Azlan. Today, I would like to present about attitudes on Knowlesi Malaria prevention behaviour among high-risk community in Peninsular Malaysia. Knowlesi is a malaria parasite of monkeys and it is transmitted to humans by Anopheles mosquitoes. According to Cox, Singh et al. 2008, Knowlesi is one of the 5 types of malaria that has high potential and risk leading to death. And World Health Organization WHO reported in 2017 69% of the total of malaria cases were from Knowlesi infection. The high-risk community of Knowlesi are the people who work in forestry industry, including indigenous people in the central interior regions, Peninsular Malaysia, as well as people who live in rural areas. Malaysia is in the preliminary process and continues to progress towards elimination 2 years ahead of goal elimination in 2020. However, the resurgence of parasite Knowlesi remains a major public health problem, in particular in the states of Sabah and Sarawak, the island of Borneo, and Peninsular Malaysia. Therefore, prevention is crucial to help control transmission of Knowlesi. And the way people understand health and disease are often influenced by individual and other contextual factors. That is the reason why we need to understand the both factors and the attitudes of high-risk community toward prevention behavior that they practice. The objectives of this study are as follows. This study used a qualitative approach by conducting in-depth interviews. The selection of the location is based on the higher number of Knowlesi cases in 2018. Kota Tinggi was chosen because of its high cluster cases. In total, we have interviewed 18 informants from the 3 states. 11 of them are those who has been infected with Knowlesi and they are all 19 years old and above. We used the semi-structured interview questions based on the integrated behavior model. The audio of the interviews were transcribed verbatimly and the analysis was done using Atlas T. The transcripts were coded thematic using a deductive approach. The figure is the integrated behavior model that we use as a framework for this study, and for this paper we only focus on the attitude. Attitude has 2 dimensions, which are 1. Experiential attitude, 2. Instrumental attitude. We asked the informants 14 prevention behaviors which are related to Knowlesi, and we asked them which of the 14 prevention behavior that they feel positively to use, and the advantages or disadvantages that they get when doing the prevention behavior. Experiential attitude is the feeling about the idea of doing the prevention behavior, while instrumental attitude explains the benefits or impacts that someone get of doing the prevention behavior. The finding shows there are 3 groups in high-risk community. Number 1, work. The informant who work as a military in Kota Tinggi or plantation workers in Gua Musang. Number 2, hobbies. This one is common among indigenous people in Gua Musang and also local people in Kuala Lipis, where they like to go into a forest for hunting and fishing. Number 3, residing. People who live nearby forests and exposed to monkeys. From the 14 prevention behaviors that we asked, there are 5 targeted prevention behaviors that they commonly use and to prevent them from a mosquito bite. They are prophylaxis, wearing long sleeves clothing when going out after 7 p.m., use a bed net while sleeping, use a mosquito coil, and use a mosquito repellent. As a conclusion, these are essential considerations for the design of prevention and control strategies for high-risk community. The intervention program is crucial because these top 3 states form a priority population for the elimination of malaria in Peninsular Malaysia. That's all from me. Thank you.